Hi everyone, it's Dr. Conlon. Today's lecture will cover Chapter 10 from your textbook, Nutrition Through the Life Cycle, and we will focus on toddler and preschooler nutrition. In our previous lectures on infant nutrition, you were introduced to the concept of growth charts, which are used to monitor children's physical growth. Normal growth is a vital indicator of health in children. In the United States, the Centers for Disease Control and the World Health Organization growth charts can be used for children aged birth to younger than 2 years old, and the 2000 CDC growth charts are used for children ages 2 until ages 20 years old. In this lecture, we will discuss these growth charts and practice plotting on one. In addition to viewing this lecture, you will complete and submit case study 10.1 from your textbook and complete several additional growth charts as practice on your own. You will also be introduced to Healthy People 2020 objectives for toddlers and preschoolers and to nutrition assessment for children's weight status. After this lecture, we will discuss announcements and reminders, and I'll talk more about the case study. So for the objectives from Chapter 10, we'll cover the ones that are listed. And in this part of the lecture, Part 1, I'm going to record this lecture in multiple parts to help your learning so that you can listen in shorter intervals at your convenience. So for this lecture, we are going to cover the objective to list 2 Healthy People 2020 objectives related to toddlers and preschool age children. So after this lecture, you'll be able to list at least 2 Healthy People 2020 objectives for early childhood. So nutrition supports critical growth and development that occurs during the toddler and preschool age years. A concept called growth velocity refers to the rate of growth over time. And in infant nutrition, we talked about how growth occurs rapidly in infancy. Infants double their birth weight by 4 to 6 months and triple their birth weight by 12 months. So even in those first 0 to 6 months of life, we have this tremendous rate of growth. And then it slows down a little bit in the second half of infancy. And then after infancy, it slows down even more. And we see after infancy in toddlers and preschool age children, they have a more steady weight gain. Doesn't mean that they're not on a trajectory that's increasing in weight. They absolutely are, but it's just slower than when they were infants. And we also see more patterns and periods of spurts and plateaus in this age group, and the weight ends up being a more steady pace until their adolescent growth spurt, when once again we have an increased growth velocity. And we'll talk about the adolescent growth spurt when we reach adolescent nutrition. So young children need adequate calories and nutrients to meet their nutritional needs. And as you can imagine, that becomes very important during their growth spurts, during times of more rapid growth. Eating and health habits established in early childhood track into food habits and subsequent health later in life. This is really important. It makes early childhood a critical time to intervene and to build healthy habits and behaviors, because we know through literature over the past several decades. So it's really robust and consistent research that has shown us that behaviors that start in early childhood, even as young as toddlers, can track into adulthood if there's no meaningful and effective intervention during those times. Or during the time between early childhood and adulthood. So starting early is really best. Of course, you can always change your health habits at any age. When we talk about nutrition in the elderly, it's never too late, even at that stage of life, to change your health habits, and it can still be meaningful and impactful and increase longevity and quality of life. But we know that the earlier, of course, the better, because you have benefits that will and ultimately last longer, and because they will cover more of the life cycle. So just something to keep in mind. So this is a really important stage of development for many reasons, including the tracking, because we want to develop healthy behaviors that track into adulthood. But there's just so much going on too for the child at this stage. They're learning and accepting new foods. They're developing feeding skills. They're establishing healthy food preferences. And they're practicing good eating habits and behaviors. So these are all characteristics that when you look at them together, what are we doing? The child is really building this relationship with food. And that relationship they have with food can be one that they have with food throughout their life. So it could be a positive food relationship. It could be negative. It's probably going to be somewhere in between with a lot of mixed reactions towards food. But wherever they land, that's all developing right now. So it's an opportunistic window then to shape a positive food relationship in this early childhood stage. Before we continue, I just want to make clear definitions that we'll be using. They're the ones that your textbook use to define life cycle stages. And you might see these vary if you look at different sources, and that's okay. The important thing is to define it. But in general, and having done my own research for my doctoral dissertation in early childhood nutrition, these are consistent with what is predominant in the literature. So learning these terms here are useful, and they are widely used definitions. So infants, the period of infancy is birth to 1 year of age. Toddlers are 1 to 3 years of age, and preschoolers are 3 to 5 years of age who are not yet attending kindergarten. So those who are in kindergarten sometimes get categorized a bit differently than those who are not. But it would depend on, so if you were looking at a research study, for example, they would need to define how they're defining preschool age. So are they just looking at whether they are 3, 4, and 5, whether they're in kindergarten or not, or did they exclude once they've entered kindergarten? That depends on different factors. But so just know that it's typically 3 to 5 years of age, or those who are not yet attending kindergarten, or those who are not yet attending kindergarten. So, and there's distinct characteristics within each stage. Ones that we focus on are toddlers have this rapid period where they increase their gross and fine motor skills. These are important for feeding. Why? Well, gross motor skills are use of large muscle groups like walking, running, riding a bike, hopping, and skipping. And in terms of nutrition, those are all physical activities. So we want children to develop healthy gross motor skills, and to be able to move freely, to exercise to the best of their ability. They also develop fine motor skills. So these use smaller muscle groups, stacking objects, writing, scribbling, coloring, tracing. And if we were in class together, I would ask you, what else? What other motor skills would be important for eating, right? How about utensil holding, right? How about pinching and picking up food, eating with hands, bringing food to the mouth? Those are all fine motor skills, and this is a really critical period of time for fine motor skill development. So we want to be aware of that. And it's not uncommon for children to have developmental delays for a wide variety of reasons in either gross motor or fine motor skills. So registered dietitians often work with occupational therapists, physical therapists, and speech therapists to help address developmental delays. And at some healthcare facilities, you'll find medical care teams that consist of all of the different types of specialists, which, in my opinion, provides a holistic approach to the child care and results in better outcome. And there is data to support that. So more of a team-based approach is a great model to work with for kids who do have developmental delays. And then in the preschool age, we see an increase in autonomy. The toddlers, they're very dependent on their parents and caregivers. Preschoolers, you see them saying more of, no, I want to do it myself. And they're trying. They may not do it perfectly. They might get yogurt all over their face when they're trying to eat it with a spoon, or we all know those classic spaghetti sauce covered toddler pictures, sitting in the high chair. And it's messy, yes, but it's so important to let our children explore food and to learn these skills, because that's how they learn, by doing. Children have broader social circumstances. They begin forming friendships. They understand friendships. They have feelings. They have very, very strong feelings. And they need to learn what they are by labeling them and how to regulate them. They have increasing language skills to express themselves. They can communicate. They can say what they want, what they don't want, what they like, what they don't like. And with all of that comes expanding behavior control. So they also learn that, okay, I do have some control of my environment. So they also like to test their boundaries. So we'll talk about this in a later part of the lecture, but some feeding behaviors around what could be categorized as pickiness may not actually be true picky eating, but usually they're actually just behavioral control responses to children testing their parents and seeing how much control they actually can have over what they're eating. So during toddler and preschool years, adequate nutrition is required to achieve full growth and development. Growth and development are our main goals right now. We know that undernutrition impairs cognitive development and the ability to explore a child's environment, and children are all about exploring their environment. So this is really impactful and hopefully gets addressed early in childhood. But there's challenges to that. We know that the economic and nutrition status of U.S. children indicate about 1 in 5 children live in poverty in the United States, and this is 2016 data. I did check if there had been updates yet, and there haven't, so that's the most recent availability. And to put into perspective, for 2016, the federal poverty threshold was $24,339 for a family of 4 with 2 children. So we know that poverty is the main predictor of food insecurity. So if 1 out of 5 children are living in poverty, then it's a safe assumption that about 1 out of 5 children are food insecure or at high risk of food insecurity. So as a nation, Healthy People 2020 has addressed major barriers and nutritional shortfalls of our population, and they have a wide variety of objectives. Here's a sampling provided in a table in your textbook that's really nice of nutrition and weight status related objectives. There are other objectives. You can go to the Healthy People 2020 website, I have the URL here that you can explore related to food insecurity, to weight status, and to food access is on there. And there's also a few others. So you can go, I encourage you to go to the Healthy People 2020 website and explore additional ones too. But for the focus of our class here are ones related more specifically to food and nutrient consumption for population ages 2 and over. So, for example, there are objectives related to increasing fruits and vegetables in the diet, also focus on increasing whole grains, and then reducing consumption of calories from solid fats, added sugars, saturated fats, and sodium. And there's also a focus on increasing consumption of calcium. So how are these objectives set? Well, they look at the baseline and it's not meeting recommendations. So then they set a target to help improve the baseline's consistency with recommendations. So, for example, if in the US population, sodium intake from 2010 was 1,118 milligrams, but the target for this population should be 1,300. So that became the goal by 2020. Hopefully, we're now seeing this level achieved. Or for fruits and vegetables, we know that children and adults don't meet the vegetable intake for age groups. So here at baseline, it was 0.8 cup equivalents of total vegetables per 1,000 calories, and the target is 1.1 cup equivalents per 1,000 calories, which is in line with the dietary guideline for American recommendations. So review this table. You can also review additional objectives that are on the website and just be familiar and be able to identify at least 2 objectives set by Healthy People 2020 for toddler and preschool age children. So with that, I'm going to end this part. And to help review this section, test yourself. Can you list 2 Healthy People 2020 objectives related to toddlers and preschool age children? And by definitions of the life cycle stage, what are the age ranges of infants? What are the age ranges of toddlers? And what are the age ranges of preschool age children? After viewing this part and testing yourself, please, at your convenience, continue with part 2. Then we'll cover objectives 10-2 and 10-6, which are assessing growth and weight status in children. Thank you.